Hi, welcome to the Thomas Carter Show. I'm your host, Thomas Carter. On my show today, we're going to talk about chronic pain. So many of you out there deal with pain on a weekly, daily, monthly, even yearly basis with no relief in sight. We take pain pills, we talk about surgery, but listen, there are other ways to get relief from pain. I have with me today a specialist in that area. His name is Dr. Stuart Marmorstein, who is a chiropractic doctor and a wellness specialist when it comes to chronic pain. Welcome to the show, doctor.
Thank you so much.
So tell us a little bit about yourself and what it is that you do when it comes to pain and some of the other things that you do in your practice.
Okay. I started out as a chiropractor in 1979 and studied many different techniques with different mentors, both in school and outside of school. And later on I found out that there's this thing called a cranium, the human skull, that's a key to a lot of chronic pain conditions. When I moved back to Texas in 2003, I had a patient in my office at that time in Conroe who had already spent $100,000 out of pocket.
Wow.
And been through all kinds of very dangerous procedures, electrical, surgical, and so forth, and she didn't get any relief. And I did a technique that I learned from an osteopath from Ireland called biocranial that has to do with adjusting the bones of the skull, and I used that to turn muscles back on. A lot of pain is due to muscles straining while somebody does normal everyday things, and she had an injury that precipitated this long-standing pain, and we were blessed to have great results where all of her pain went away and she resumed a normal life. After that, I started studying other techniques to complement what I was doing, and now many people come in from all over the world and from many different states in order to get non-drug related relief from pain.
That's very interesting. Now, I want to ask you something, right? Because a lot of people, they have this fear about going to a chiropractor. So can we spend a moment in alleviating some of that? Because there's a lot of myths, there's a lot of false stereotypes, again, in terms of chiropractic medicine.
Okay.
So can we kind of address some of that again?
Absolutely. A lot of the traditional methods that are taught in chiropractic college are generally safe, and some of them also can make noise when somebody's doing a kind of manipulative procedure. Generally speaking, somebody who's well trained in that won't hurt somebody,
Right.
whereas if somebody who's a lay person who has no training in it will. Going a step further, though, in my own practice, I've found a way not to need those procedures, and all of my work is soft. There are no sudden movements, no heavy pressures, and it's very gentle and safe. I work with people who are in their 90s, and I work with infants with no incidence of trouble or unwanted symptom creation.
That's phenomenal. Now, what other things do you do in your practice besides that? Are there other things that you incorporate?
I use a number of interesting techniques that I've been exposed to along the way. One is called pain neutralization technique, which I've learned from a chiropractor and acupuncturist in the Denver area.
Okay.
And he's an interesting guy. He's been probably a contemporary of mine. I've been at it a while. I've been a chiropractor for 36 years. And in his classes, you'll find everybody from massage therapists to medical pain management specialists who will fly in from all over the world to learn these very simple neurologically based techniques where you can use a simple reflex or acupuncture meridian maneuver using just light fingertip touch, and the pain goes away on the spot.
Wow, that's something.
I could show you what that's like sometime later on if you'd like to see it.
Yeah, absolutely. I see we have a skull here on the table. So what is that for?
Okay, the skull is in a way, the way I started with helping somebody who had the pain. If it's okay,
Sure, absolutely. Feel free.
I'll open this skull up, okay? Now this is a plastic model of a real human skull, and if we take the top off, one of the things you can see if you can get a close-up of this is that The skull is asymmetrical. The contour shape of this side is different from that side.
Okay, that's interesting.
I don't know if you can see that.
I can see
or
that,
not.
right. It's different.
And if you look at these two arches, that's very easy to see even from a distance. They're quite different from one another.
Right.
And what happens that causes this can be something like a whiplash accident where muscles on the back of the head will pull the 22 bones in the head out of alignment.
Okay.
They move throughout life, and because of the fact that there are so many, the shape can be changed by something like that. It can also be changed by long dental or orthodontic procedures. And one of the most common ways that the head gets distorted is just from the birth process.
Is that right?
So,
just from being born?
yes. Now, there are special circumstances with birth, like twins, where it gets crowded in the womb. Another one would be a situation, I saw somebody just yesterday who had a forceps delivery when he was born back in the 40s, and there are actually marks in his head from the forceps.
Really?
And he said he's really happy he has a good head of hair so that it's covered up. But the problem with the head getting out of shape, there are a couple of them. One is that there's a thin lining that wraps around like this. It attaches to the wall of the skull.
Okay.
And it divides the brain into top and bottom and into right and left sections. That lining comes out of the bottom of the skull with the spinal cord, and it attaches to the top two bones in the neck, and it attaches to the sacrum at the base of the spine. And of course, what are most of the pains that people coming in to see me with? Headaches, which goes with neck trouble.
Right.
Shoulder trouble, which goes with neck trouble. Low back pain and sciatic pain going down the leg. And a lot of these things resolve just by working on the bones of the head and taking the tension off of that lining.
Really?
So,
okay.
but it also helps to restore function because the brain is the controller of the body. At least we hope it is. But sometimes things that happen to people will change the way that the brain can communicate with the body, the muscles, and the organs. And that's the start of many chronic pain situations. Muscles move the bones of the spine into misaligned positions that can irritate the nerves. And of course, those nerves go to our joints and our muscles and cause us to walk out of balance, and then the joints become irritated, and it
so we got pain patterns, right?
You get pain patterns,
right?
But they're reversible.
Really.
And I've found that it really doesn't matter that much how long somebody has had something. Most of the time, you can turn it around and get them better and do it without drugs or surgery.
And see, that's the thing I want to talk about, because you're right, absolutely. So many people walk around today in chronic pain, and they've been like that for years. And as you said, so I guess from what most people experience is either drugs, which doesn't fix it, it's just a Band-Aid, right? Or surgery. And that seems to be the option. And a lot of people, they don't want to take drugs, they don't want to do surgery, and so they're in this weird place of walking around in pain.
Right, and it's very non-productive, it's very dangerous, and often will cause them their livelihood and even their will to live. And of course, many people could be susceptible to addiction to some of the pain-killing drugs, which are becoming more and more powerful.
Right.
And that's becoming a problem in society. Not just street drugs, but pharmaceutical drugs that are becoming street drugs.
Right. So there is some solutions that are available then to people.
There really are.
Okay.
And one of them that I use a lot, besides the cranial work to turn the muscles back on, is I use something called pain neutralization or pain elimination technique in order to get rid of a major source of pain, which is called myofascial trigger points.
Okay. And what are they?
Basically what happens, Thomas, is that when a muscle contracts, it can squeeze the blood vessel that feeds it.
Okay.
So if the flow of blood into the muscle itself becomes diminished, then the tissue becomes deprived of oxygen, and that tissue will become characteristically tender to the touch. So if I were to rub a place like this, I would just feel pressure, but if you go into a trigger area, what will happen is a person will often flinch because it hurts to rub it, and it shouldn't. That's a sign that there's something wrong there. And yet there are some very simple techniques that are based on the neurology of the brain and the spinal cord that can make the pain go away often within seconds, and these can be long-lasting corrections.
I'm going to ask you this because you said something I thought was very interesting. Because a lot of people, again, walk around in pain, and sometimes they don't feel the pain until somebody touches that spot, right? So what is that?
Okay, well, what happens again is if the body, in its attempt to adapt and deal with the fact that it has to walk around in pain, tightens, then the muscle squeezes the blood vessel, and that will affect the nerves coming out of the muscle, and the signals that are sent up to the brain through the spinal cord are interpreted in the brain as pain.
Okay. So then that's why you can be in pain and not necessarily know it until it reaches a certain level where now it's obvious.
Well, people tend to develop different kinds of compensation patterns. So what happens is somebody learns to live with it, or they take some over-the-counter stuff like Advil or aspirin or Aleve,
like that, right?
but they're having to keep taking it, and then they develop stomach problems and so forth.
Right, and so it further complicates the situation.
And then they start to walk out of balance, and then something else starts to hurt.
So you're feeling like you're 90 years old and you're 30 years old.
I've literally seen that scenario many times where people develop chronic pain even if they're still in their 20s. Sometimes that's after a sports injury in high school or college, and sometimes it's just from sitting at a desk too long and having a bad posture and poor seating, maybe a computer monitor that's off to the side, ergonomics are off, and before they know it, they have a problem. Also, a big problem is automobile accidents and falls, which sometimes don't feel that bad right away when they happen, but within 2 to 3 weeks, inflammation sets up and then the person's in trouble.
Okay, so listen, we're going to take a quick break, and when we come back, can you give us some demonstrations of that cranial stuff or some of the things that you do?
I'd be delighted.
All right, so just stay tuned. I'm Thomas Carter. We'll be right back with Dr. Marmorstein. Hi, I'm Thomas Carter. Welcome back to the Thomas Carter Show. Today we're talking about pain and pain management. I have here with me Dr. Stuart Marmorstein, who is a chiropractic specialist who's going to show you a very unique technique that he uses on his patients. Doctor, you ready? I'm ready.
Okay. All right. What we're going to demonstrate right now, Thomas, is something called applied kinesiology. This is a diagnostic method that uses the body itself to tell what's going on in the body and where there's trouble and where things are okay. With this, we use resistance muscle testing, and of course you have to be careful to follow certain rules so that the test is valid. May I borrow your left arm a minute?
Sure.
Okay. What I'm going to do is I'm going to push the arm toward the floor and keeping your elbow straight.
Okay.
What I'd like you to do is resist or push against my hand and don't let me push it down, okay?
I'm ready.
And when we push like this, you have a really good arm. You must be an athlete.
Feels good.
Okay, it feels good. Now what we're going to do is change the test just slightly. Can you turn only your eyes and not your head toward the right?
Okay.
And now hold the arm again, and it goes down just with fingertip pressure.
Okay.
Okay. Let's try it the other way where you turn only your eyes to the left.
Okay.
And now hold the arm, and again the arm goes down. So before we correct this, which of course we have to do, what's the significance of this? Well, in real everyday life, people get hurt. There's all kinds of things that can happen that traumatize us, and a lot of times we brush ourselves off and we say, oh, nothing's broken, there's no blood all over the floor, so everything must be okay.
Right.
But what happens is when we have a trauma, like let's say we're rear-ended, or we fall, or even if we have a terrible emotional shock, it changes the way the brain processes information. And until we reset this, it will send confusing signals to muscles.
Okay.
So if something like that happened to you and we wanted to correct it, because in real everyday life, if you're going to drive a car or read a book or a computer screen, you have to turn your eyes right and left.
Right, to see.
Then if we correct that, then you won't have to keep on living with that as a complicating factor. This is also a reason why sometimes people get treatments that look like they would otherwise be effective, and they might even have relief on a short-term basis, but then the treatment doesn't tend to last very long,
and it comes
then
back.
they become very frustrated.
Right.
And if we're trying to keep costs down, we want to make sure that whatever we do that helps somebody lasts.
Because that's a part of the problem right now. As you said, it keeps recurring and recurring, and we're in that cycle.
And then people give up and they say, well, I guess I better take drugs.
Right.
Okay, so let's fix this now. Can
Okay.
you put one finger inside your belly button?
Okay.
There's an acupuncture point inside the belly button. It's very powerful. And if I may, there's a point here and here, and we're going to rub those three at the same time. Very gently, just like this.
Okay. Feels pretty good.
Feels pretty good. Okay, and that's all it takes. Now if we test your arm again and you turn only your eyes to the right again,
Okay.
and hold.
Wow, that's
And then
pretty cool stuff.
And then to the left.
That's amazing.
We got it.
We got it.
Hard to believe, isn't it?
Hard to believe. Did you see that? Listen, we're going to take a quick break. When we come back, we're going to talk to the doctor some more. So stay tuned. I'm Thomas Carter. We'll be right back. Hi, I'm Thomas Carter. Welcome back to the show. I'm here today with Dr. Stewart, and we're talking about chronic pain management. Okay, Doc, when we left off, you did something really incredible. You have some other tricks up your sleeve?
I've got a few,
Okay.
more than a few. And it's not that there are so much tricks, but that they are part of the way we're designed. I believe that we are really divinely designed, and that there's such an intelligence in the universe. The reason that we can get well naturally is that we're designed to get well naturally.
Right.
We're designed to heal, but you have to get the blocks out of the way.
Exactly.
What we just did before was an example of a block where the brain was confused because of a previous trauma, and we reset the circuit just like rebooting a computer, and now that's okay.
I get it.
We can also do that with getting rid of a pain right on the spot.
Okay.
An easy place to demonstrate would be in the shoulders. I don't know if you have tension.
I do,
or
all the time. I
right
stay
there?
stressed. Yeah.
Okay.
I stay stressed.
A lot of people have tension right there.
Okay.
Okay, so what I'm going to do is I'm going to rub a spot here.
All right.
And tell me if it hurts, okay?
Yes, it does.
It hurts, okay. Now, it's not hurting with a lot of force. I'm not using very much force here.
You're not.
If I do a little technique like this, does that change it?
It does. It's getting better.
Getting better. And how about now?
It's almost gone.
Almost gone. And how about now?
It's gone.
It's gone. Okay. This is an example, of a very simple one, of pain neutralization technique. This is a method that we can use to get rid of pain anywhere in the body, whether it's headaches or plantar fasciitis on the bottom of somebody's foot, or a really bad low back pain even after surgery. You can get these things to go away. The fact that something shows up on an x-ray or an MRI doesn't mean that it's the cause of the pain. If you take anybody past a certain age, you'll see arthritis in their spine on an x-ray.
Right.
But that doesn't mean that the problem is from the arthritis, and oftentimes if you deal with the soft tissue problems, the pain goes away and stays gone.
That's something.
And
I guess it's that complex, but that simple. Then
it really is.
that's something. I want to ask you one other question while we're here.
Okay.
With those kind of techniques, and again, the general public not that aware of it, how can a person get a hold of you to learn more about what it is that you do?
Okay, well, I have a website which is headtofoot.info, INFO. That's the main easy one to get in touch with me at. And I also have a telephone number which is 713-831-6875.
All right, so listen, we're going to take another break. We'll be right back with the doctor. A few more questions, so stay tuned. I'm Thomas Carter. We'll be right back. Hi, I'm Thomas Carter. I'm here today with Dr. Stewart, and we're talking about chronic pain management. Doctor, on my show, I always ask my guests this one question. What is called TC's Teachable Moment. So what one thing have you learned in your life that you want to share with the audience that so impacted your life that you carry it around with you right now?
I would say that the single biggest thing, if I had to just pick one, would be always keep learning, always be open to new things. Whenever I think I've seen it all and that nothing could top what I've seen before, especially when it concerns the human body, we're so miraculously made that we'll never understand it all. The circuitry is in us to help us heal from internal disorders, from pain, from all kinds of things. So just stay open. There's always going to be something new, and that's one of the things that keeps life fresh and enjoyable.
So, Doctor, I want to thank you for coming on the show.
Oh, thank you.
And you know, I'm feeling better already. This was great. I'm Thomas Carter, and as always, listen, don't walk around in pain. You've seen some really great stuff here, so take it to heart and realize again that you want to be healthy, be happy, and live an amazing life. I'm Thomas Carter. See you next time.